Hello, welcome to today's presentation, Protect Your Brain, Hypertension, Stroke, and You, presented by Dr. Jack Rose, neurointensivist with Washington Health Medical Group. Dr. Rose is an expert in neurointensive care and cerebral vascular disease, and was among the first 100 physicians in the world to become board certified in neurocritical care. He is also board certified in neurology as well as vascular neurology. In early 2014, Dr. Rose was recruited by Washington Health Medical Group to augment Washington Health's comprehensive stroke and neurosurgical programs. He is now the co-medical director of the Washington Health Stroke Program. Please welcome Dr. Rose.
Thank you for the introduction, and I'm happy to present this talk about hypertension and how to protect your brain. What is hypertension? Well, hypertension is a medical term for high blood pressure. Blood pressure is just the measurement of how strong the blood effects are on the arteries, which are the strong-walled blood vessels that bring blood from your heart to your body. And if the blood pressure is very, very high, then we describe you as having a condition called hypertension. Hypertension is very common, but sometimes you have no symptoms of having high blood pressure until something serious happens. But why does this matter? Well, hypertension, or elevated blood pressure, is a major risk factor for heart disease as well as stroke. And high blood pressure can damage blood vessels and organs, especially if it goes undetected or untreated for many years. Hypertension is one of the most common medical problems throughout the world, and it affects millions, and it may be one of the most common health disorders globally. The American Stroke Association reports that almost half of strokes, which are injuries to the brain from blocked or broken arteries, can be prevented by simply controlling high blood pressure. They recommend that the number that you measure of your blood pressure should be kept less than 120, the top number, over 80, the bottom number. And there's almost no limit to how much you can benefit from having lower and lower blood pressure. Although sometimes if you treat the blood pressure too low or your blood pressure gets too low, you can faint or have problems. But the vast majority of the time, we like the blood pressure to be as low as possible. And it may be the most important risk factor for preventing heart attack and stroke that you can look for and treat. It's estimated that almost 30% of American adults have high blood pressure, but yet only about 50% of those with high hypertension will have their blood pressure under good control. And part of that has to do with a large number of American adults, perhaps 65% in recent estimates, are overweight or obese. And obesity or being overweight is one of the strongest risk factors for having high blood pressure. What happens if you have high blood pressure in terms of how it affects your body? Well, it can cause stroke, like I mentioned. That's here, affects the brain. Too much blood pressure can lead to blocked arteries. It can lead to broken arteries, and can also lead to bad headaches and thinking problems. Blood pressure that's very, very high and not treated can also lead to heart disease, either heart attacks, where arteries get blocked, or heart muscle strength problems such as heart failure. Also, the large artery coming off the heart here that I'm putting my arrow at, that's called the aorta. If you have untreated high blood pressure for many years, the aorta can grow in size and can tear or even rupture, which is life-threatening. Also, having untreated high blood pressure can damage your kidneys. And if you happen to have kidney disease, it can secondarily raise your blood pressure. So how do we define high blood pressure or hypertension? What numbers mean that you have normal blood pressure versus high blood pressure? Well, the normal number should be less than 120 over 80. And those two numbers, the top number is also called the systolic blood pressure, and the bottom number is called the diastolic blood pressure. What that means is whenever your heart beats and squeezes and pushes the blood towards your body, that when it's actively contracting and the blood is pushed through the blood vessels, The force that's produced onto the arteries, that is called the systolic blood pressure. That's the top number. And that's why it's higher than the bottom number. That's the diastolic blood pressure. That's the pressure of the arteries when the heart's in the relaxed state, when it's relaxing. It's not actively pushing the blood into the arteries. And so both numbers matter. We describe having elevated blood pressure if the first number, that systolic, is between 120 and 129 millimeters of mercury. That's the measurement unit that's used for measurement of blood pressure. But yet the bottom number is less than 80. That's elevated blood pressure, whereas normal blood pressure is less than 120 over 80. Stage 1 hypertension is defined as that first number, the top number, systolic, in the 130s, with the bottom number in the 80s. Stage 2 hypertension is if the top number is equal to or above 140, and the bottom number is equal to or greater than 90. And the higher the blood pressure, the higher the risk of having medical problems related to high blood pressure. So what causes hypertension or high blood pressure? Well, a lot of it has to do with genetics. If you have other relatives that have high blood pressure, you're at increased risk for also having hypertension or high blood pressure. There are other medical conditions that you may have that contribute to hypertension, such as kidney disease from something else perhaps, not just hypertension itself. If you have sleep apnea, for example, that can also lead to hypertension. And then there are lifestyle factors that contribute. If you eat an unhealthy diet, especially a high salt or sodium level diet, if you're physically inactive, if you're overweight or obese, and if you drink excess alcohol. So there are a lot of risk factors that you can control in terms of your diet and nutrition to help treat blood pressure or make sure you don't have high blood pressure, such as having good exercise habits, not smoking, not drinking alcohol, or if you do, drink a minimal amount, managing stress, sleeping effectively, good sleep hygiene, and treating any associated medical conditions with your healthcare team. There are some risk factors you can't control, such as your age. Blood pressure commonly can go up with age, especially that top number. The systolic blood pressure commonly rises with age. Your race or ethnicity also can sometimes play a role. For example, Black Americans have a much higher risk of having high blood pressure and having it less controlled on average, at least in the United States. And then genetics. Obviously, you can't control what you were born with. And then what happened? Are there symptoms if you have high blood pressure? Well, especially early on, you may often have no symptoms from it. And sometimes this is why we describe high blood pressure as sort of a silent killer or a silent disease. But if the blood pressure is severely high, it can cause chest pain, it can cause headaches, dizziness, you can hear your pulse in your head, you may have visual changes or disturbances, you may get confused, and you may have a heart attack or a warning sign of a stroke called a TIA or a stroke. And so these are the main complications of uncontrolled high blood pressure. That is heart attack, stroke, which can lead to permanent injury or disabilities, kidney damage, damage to your eye, the retina is the back part of your eye, vision loss, and heart failure. How do we diagnose blood pressure? Well, you have to measure your blood pressure. And so it's important to have multiple readings on different days in different settings. And we don't just care about what the blood pressure numbers are when you go to see the doctor or you visit the pharmacy to have your blood pressure checked. We care about what your blood pressure is most of the time. And so that's why if someone has hypertension or we want to look for it, and treat it effectively, you really want to have a machine at home so you can measure it accurately and regularly. And then you want to make sure you're doing the proper lifestyle modifications so that you keep your blood pressure as low as possible. And that includes eating a healthy diet. Sometimes a DASH diet is one of the recommended diets. Getting regular exercise, making sure that you're not overweight, or if you are, managing it and losing it healthy, limiting your salt intake and reducing alcohol intake. And then other things that you can do to bring your blood pressure down, like we mentioned before, is to regularly exercise, get some degree of aerobic exercise weekly, keeping your weight down, no more than moderate to mild drinking, like we said, alcohol, low sodium diets, and if you have hypertension and your physician or other healthcare provider has prescribed medications for you, make sure you take them regularly and follow up with your healthcare team. In terms of healthy diet tips, it's like I mentioned, limit your salt intake, eating healthy fruits and vegetables, reduce or minimize processed foods, and eating more whole grains and lean proteins. Additionally, make sure to buy a blood pressure machine if you've ever been diagnosed with high blood pressure. If you're only going to snack during the day, you want to make sure they're healthy snacks and not necessarily salty snacks. Sometimes you can get help in terms of controlling your weight with programs such as Weight Watchers, or visit a dietitian, or read some information about healthy nutrition. You can join healthy cooking classes, start to look at your food labels, and eat a lot more fresh foods and cooking at home as opposed to eating out. And then very importantly, avoid a sedentary lifestyle. Our bodies are best to maintain your health, best by being physically active. So make healthy choices in terms of your food and your exercise. After dinner, go for a walk. If you're going to socialize with friends, don't necessarily only doing it sitting down at a bar. And learn new leisure activities that you like that also provide exercise. In terms of exercise, we recommend at least 2 to 3 hours at a minimum of moderate activity weekly. And keep in mind that it doesn't have to be lifting heavy weights at a gym or doing very, very high exertion exercise. Simply walking regularly or cycling, even on a stationary bike, or swimming are outstanding exercise. But adding some kind of strength training 2 times a week also was very helpful. And then if you are a hypertensive and your physician recommends you take medicine, the good news is that we have many, many different medications to help you with. And there's a number of different classes of which blood pressure medications you can take to lower your blood pressure. Some of the most common types of blood pressure medicines are described as diuretics. Those help you urinate to minimize water retention. There are medicines called ACE inhibitors, or ARBs. They affect how the kidney talks to your heart. And then there are medicines called calcium channel blockers, or beta blockers. They work on the heart or the receptors in the artery walls to relax the blood vessels and slow down the heart rate. And then vasodilators, which are drugs that directly open up arteries. So each of these medicines lower blood pressure in different ways. Some affect the heart, some only affect the blood vessels, and sometimes it's not unusual for you to take more than one class of medications. And some people need to take several medications. But the goal is to only take as many medications at lowest dose as keep your blood pressure healthy. Because all medications that have good effect have some side effects. And so you will be told about what these side effects might be and how to watch out for them by your physician. So it's always important to take your medications as prescribed and don't stop them without medical advice. And it's crucial, if you have high blood pressure, to monitor your blood pressure at home. You want to make sure you have a blood pressure machine that measures your blood pressure at your arm, not the wrist. The blood pressure machines in the arm are much more accurate. And it's always a good idea to bring your home blood pressure monitor into your doctor's office so that you can make sure that it's giving you the accurate readings, and have your machine checked at your doctor's office to make sure that it's accurate. You want to record your blood pressure at least 2 times a day while you're seated with your arm supported on a table or the arm of a chair, and be relaxed, and then push the machine and check your blood pressure. And document what the blood pressure and the heart rate is that the machine tells you, and keep a diary and bring that diary into your physician or other healthcare provider so that they can go over the results with you and make any kind of lifestyle or medication adjustments needed. And then when to seek acute medical help if you have high blood pressure. Well, if your blood pressure readings are extremely high, for example, more than 180 over 120, and if the blood pressure is elevated either at that level or even less than that, and you have any kind of acute chest soreness or pain, any acute back pain, any shortness of breath, if you have a sudden severe headache, or if you have any signs of a blocked artery stroke. And there's a good mnemonic device you can learn called BFAST, and that's to recognize the signs or symptoms of a stroke. And B stands for balance. So suddenly if your balance is off, you can't walk straight or stand appropriately, that could be a warning sign of a stroke. E is for eyes. If you suddenly lose vision either on one side of the world or on one eye, or you see double, then that's a potential sign of a stroke. F is for face. If suddenly your face gets weak on one side or is droopy, that could be a sign of a stroke. A is for arm. If suddenly you get weakness of one of your arm, or for example also your leg, that's a potential sign of a stroke. S is for speech. If suddenly your speech gets slurred or you can't understand or create language, that's a sign of a stroke. And then T in the BFAST is for time, because stroke is a medical emergency, and if you have any of these BFAST symptoms come on acutely, you want to call 911. You don't want to wait and see if it gets better, or bring yourself or have your family member bring you to the emergency department. You want to call 911 and get evaluated in the emergency room immediately, because we do have very time-sensitive and effective treatments for stroke. So the takeaway message here is that hypertension is very prevalent, it's very common, and it can be unrecognized for many years. But the good news is that it is also manageable and treatable. Healthy lifestyle choices do make a big difference. You don't only have to take medications or many medications to control your blood pressure, although sometimes you have to. It's important to know your blood pressure numbers, to follow them regularly if they're elevated, and to be proactive and work with your healthcare providers to make sure your blood pressure is well treated. And also to know the signs and symptoms of heart attack and stroke, and act immediately if any of these are suspected by calling 911. Thank you very much.
Thank you. We do have a couple of questions. The question would be, if you are not diagnosed with high blood pressure, would it be a good idea for you still to have a blood pressure machine at home to check periodically?
Yeah, that is a good question, and the answer is it is likely a good idea, because there's no way for you to predict whether you're going to develop high blood pressure. And like I said, age itself is a risk factor for having or developing high blood pressure. And there are a lot of things in your life that you can't necessarily control. And so you might develop high blood pressure even if you didn't have it before. So I think it is a good idea to have a blood pressure machine at home, and to check occasionally even if you don't have high blood pressure.
Okay, thank you. Our next question is, oftentimes a doctor will tell you to check your blood pressure at home if you do have high blood pressure, but when should you be checking your blood pressure at home? Yeah, and how often?
Another good question. Most of the time we recommend, at least to start, you check your blood pressure in the morning and the evening. And it's especially a good idea to check your blood pressure more than once a day, especially if you're taking any medications, because there are effects of the medications to lower your blood pressure that may wear off at a particular point in time, and then the blood pressure may go up later in the day. And some people naturally have higher blood pressure in the morning, and some people have naturally higher blood pressure in the evening. And you don't know what your typical individual pattern is until you start monitoring it. And if you happen to be on more than one blood pressure medicine, it's important to talk to your doctor about potentially spacing out the blood pressure medicines so that you don't take all of them at once, so that hours later when the medicine effects fully kick in, your blood pressure gets very low, but then when they wear off, it gets high again. And so one of the ways to avoid this sort of up and down roller coaster of the blood pressure is to space out your blood pressure medicine, say in the morning and then the evening. So it's important to measure your blood pressure at least 2, sometimes even 3 times a day.
Okay, thank you, Dr. Rose, for this insightful presentation. This does conclude our program, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on YouTube.